Hi, I'm Bariatric, and I decided to do my speech over bariatric surgeries. Bariatric surgeries are a variety of different procedures that assist people in losing weight. They are much more drastic than the everyday dieting, and they allow people to have a healthier lifestyle because really it's not a choice. The things that you eat highly affect on how much weight you lose. The U.S. National Institute of Health says that the best candidates for the surgery are people with body mass index or BMIs with 40 or higher, and also patients with BMIs of 30 that have coexisting medical conditions such as heart disease, high blood pressure, sleep apnea, and diabetes. All are good candidates for the surgery as well. The three surgeries I decided to go off of were gastric bypass, the gastric sleeve, and the lap band surgery. Brief descriptions of each would be the gastric sleeve cuts down the size of the stomach to just 25% of the original size. It makes it into a banana shape and eliminates the excess portion of the stomach that is not reversible. The gastric bypass reduces the stomach size to just 15% of the original size of the stomach, and it also reroutes the new pouch of the stomach to just 3 feet of small intestines. It is also not reversible. And the lap band is a small silicone band that gets put around the top portion of the stomach as it makes a pouch. The band is adjustable through a port that is just under the underlaying of your skin. With a needle, it can be adjusted with solution that inflates and deflates the band. There are different pros and cons and risks with each surgery, as is anything else. Some of the complications and risks for the gastric bypass would be hernia, hemorrhaging, bleeding, infection, bowel obstructions, and leakage. The sleeve is bleeding, leaking, womb infection, and blood clots. The band can slip, and it can also corrode into the lining of your stomach to where it would never be able to be taken off again. But the positive parts of it is the band could help you lose from 30 to 50% of your excess body weight. The gastric bypass would cut down up to 75% of your excess body weight, and the sleeve cuts down to about 60% of your excess body weight. These are just potential numbers. It also depends on the type of person it is and who is following the diet and the strict regimen of things you need to do, as far as vitamins that you need to take and stuff like that for malabsorption. I personally had the surgery a year and a half ago, gastric bypass that is, and I've lost 125 pounds. I recently got married, so I wasn't trying to rush the weight loss because I had a dress that already fit, but now that the wedding is over, I've already lost another 15 pounds, and I hope to get down to lose almost 80% of my excess body weight. The recovery processes for these surgeries are the sleeve. You're in the hospital for 2 days since it is minorly invasive. There is no real big incisions, it's just 5 small cuts that are on your stomach and about 2 sutures per cut. And you can go back to work within 2 weeks, but it would be light duty for up to 6 weeks. Along with gastric bypass, you stay in the hospital for approximately a day and a half, and you'll return back to work within a week, but you are on short, disability or light duty for 4 weeks. The lap band, I've had people who've had it before and they went in on a Thursday and went back to work on Monday, and within 2 weeks they were able to go right back to their daily lives like nothing had ever happened. Yeah, that's basically the summary of all the speech. I would consider it very useful and effective in many lifestyles that I've come across. Seeing that I am in a recovery group for people that are overweight and are trying to lose weight the hard way, I guess you would say. It's something that's very common, and many people struggle with it. And this is just a easy or pretty much a last resort to a solution. I had struggled with weight loss for 15 years, and I'm only 25, so it was just a long battle, and I wanted to ultimately get rid of all the problems that I would have from my bad genes, like blood pressure and diabetes, heart disease, sleep apnea, all run in my family. So I was trying to pretty much eliminate myself from having to follow in my family's footsteps. Alright, and that is the end of my speech. Thank you.